Right, everyone. Thank you so very much for being here today. Hello and welcome. This is our first lunch and learn session of the 25-26 program year, and I'm excited to kick it off with all of you. My name is Winifred Smith Jenkins, and I serve as the Director of Early Childhood Policy and Advocacy here at Advocates for Children New Jersey. And if you're new to ACNJ or not quite familiar with us, we're the largest nonprofit multi-issue child advocacy organization in our great state. Our work is centered on one goal, making sure every child has the opportunity to grow up healthy, safe, and educated. And that's why we created these lunch and learn sessions to carve out space where we can talk together about issues that shape the lives of New Jersey's children and families. We know from conception to delivery, a child's health and well-being begin with the health and well-being of their parents. But for far too many Black and Brown women, regardless of education, insurance, or income, pregnancy and childbirth are not always joyous occasions. You have systemic racism, microaggressions, and unequal treatment in the healthcare system that create barriers that put mothers and babies at risk. We also know that when mothers are fully supported during birth, outcomes improve. Both mom and baby are more likely to start life healthy and securely attached. That's why today's session focuses on the critical role midwives and doulas play in supporting families before, during, and after childbirth. We are so excited to welcome today's speakers. We have Trinisha Williams and Jill Wodnick. Trinisha is the president of the board of American Association of Birth Centers. She is a seasoned midwife and maternal health advocate with over 20 years of experience, advancing women's health and leading community-based healthcare initiatives. Jill is the Assistant Director of Maternal Health Policy at Montclair State University. She's a doula, a childbirth educator, and a policy advocate who has worked at both the community and national levels, testifying before legislators, advising on policies, and helping to advance more equitable maternity care. Please join me in welcoming both Trinisha and Jill. And just a quick note, for those who have joined our Lunch and Learn series before, today's session will look a little different. Jill and Trinisha will start off by sharing information they want us to know about doulas and midwives, and then we'll move into a brief moderated discussion followed by a Q&A. So without further ado, Jill, the floor is yours.
Sure, and I just need to make sure that you can let me share my screen. We got it? Okay, perfect. Thank you so much. Advocates for Children of New Jersey has made the state of New Jersey healthier, more just, and more joyful. So anything that ACNJ does is centered in the value and critical care that what surrounds us shapes us. And I'm so honored to be part of this small conversation today. My name is Jill. I'm a mom of 3 in New Jersey, and I work at Montclair State. And I want to start with just sharing and centering reproductive justice as the foundation of this conversation. I'm going to talk briefly about the role of doulas, and then I'm so excited that you get to hear from a midwife and you can understand the differences. But I just center all of us, especially at this moment in time, that we are talking about maternal health, and maternal health is under the framework of reproductive justice, where we center the dignity of each person. We are also having this conversation at this moment in time with 2 other external energies. The first is that New Jersey just celebrated National Breastfeeding Month, and specifically has a brand new website called New Jersey Supports Breastfeeding. I'll put that in the chat at the end of this presentation. But as part of what you're going to hear about the role of doulas and infant parent attachment and the support of doulas for breastfeeding, initiation, and retention, it's only right that we acknowledge this wonderful, wonderful new resource called New Jersey Supports Breastfeeding that was just launched. And so if you haven't had it, take a look at it. We're also having this conversation as we celebrate Birth Center Week. Birth centers, which is a focus of community-based care where births can safely happen, And we're not focusing on where birth happens today per se, but I just want to say, if you don't know that this is National Birth Center Week, take a look. There's a lot happening on social media, information, and education on Birth Center Week. So we're having this conversation with all of this. And thank you again, ACNJ, for the dialogue and the opportunity to share. I want to just level set because oftentimes there's maybe misunderstanding or myths about who is at maternity care. And what I'll be sharing very briefly about is doulas. And doulas are trained non-clinical support people that really support the experience of comfort, education, and advocacy for high-value maternity care. You're going to hear from a wonderful external colleague of mine who's a working midwife, who's going to share her experience as a licensed clinician. And there's also family physicians and obstetricians that focus more in the surgical realm and have a part of high-risk pregnancy issues. And what I hope that you hear is a healthy integrated maternity care system includes a diverse retained workforce, parity in reimbursement, and quality for families in New Jersey. But there really is a difference between doulas and midwives, and often they're conflated together. So I just want to level set. And doulas, of course, have been around since the beginning of beginningless time. But I remember I was on call, and at this moment in time, I only had one child. When this was in this was in the Wall Street Journal in 2004, right? So we're talking more than 20 years ago. As doulas enter delivery rooms, conflict arise. I'm a lifelong newspaper reader, and I was literally leaving to do labor support at St. Barnabas. And this article came out that said, there's a new workforce entering obstetric wards. They are often strangers to the staff and unrelated to patients. They aren't licensed and aren't required to have any formal medical training, and they are sparking protests in the medical community. These workers are called doulas. And this article was right. Doulas do peer support, education, comfort measures, and education. And the value of emotional safety and education really brought a new workforce and a tool of one of many tools of really recognizing the inadequacy of how maternity care is delivered. So that article was more than 20 years ago. And where are we right now in 2025? Well, right now in 2025, more than half of the states have their Medicaid payment system or even private insurance paying for birth doula services. We've come a long way as doulas, and we have a lot more ways to go. But let me just level set and explain. You're going to hear a lot about doulas making a difference in what used to be called the triple aim: improving outcomes, reducing costs, and increasing patient satisfaction. So Dr. Decker wrote this, or made this visual organizer of why are doulas, the therapeutic presence of someone, why is it making a difference? And this is for a longer conversation. Today is just a short overview. But continuous labor support, that interpersonal care, the interpersonal neurobiology of self-regulation, means that there is increased oxytocin, increased mobility, increased self-esteem, decreased pain, and decreased anxiety while giving birth. All of those hormones impact the physiology of birth. Doulas are only part of a tool in the maternity care system, and I'm just doing this as a brief overview. But to level set, there's 4 key roles of doulas. If you want more, definitely take a look at the QR code. This was a consensus statement that was done by 4 tremendous and terrific organizations. So the 4 key roles of doulas provide information about childbirth and foster communication between women, families, and members of the healthcare team. Doulas play an advocacy role. really helping women and people to achieve desired experiences, navigating a very complex maternity care system. Doulas provide practical support, anything from birth balls to massage, but it's that practical support that can really level set and really, really understand and have anticipatory guidance. And finally, doulas provide emotional support, a sense of confidence and control. If you want more, read this report. It's fantastic. So another way of, if you're new to understanding what doulas do, what are doulas taught, right? So doulas are, as a sweeping generalization, are taught to recognize birth as a key life event. That really is very important, and I don't want to gloss over that. Really recognizing that birth is a rite of passage, birth is a key life event, and needs to be treated with the high value, the evidence, and the dignity that would be happening. Nurture and protect the memory of birth, maintain an uninterrupted presence, recognize the effect of emotions on physiology of labor, provide comfort, facilitate positive communication, and promote early breastfeeding and bonding. There's so much more woven in between that, but those are some of the highlights. And to level set, doulas cannot be charged with fixing nor saving a broken maternity care system. Doulas can offer support, resources, advocacy, and education. Systemic change incorporates doulas, but instead focuses on how maternity care is delivered, from the payment mechanisms, and that the United States underutilizes the midwifery model of care. And I am so glad, and I thank ACNJ for the wisdom of pairing this dialogue up for the role of doulas and the role of midwifery. They're different models. They work synergistically, but they're unique. And the midwifery model of care is an evidenced high-value way of supporting maternal health. So you're going to hear about that. But part of what doulas recognize is the complexity. In the United States, we have overused procedures like induction for non-clinical reasons, episiotomy. We also have underutilized procedures like continuous labor support, non-supine positions for giving birth. And this is the complexity of the art and soul of doula work that is not client-facing, but is recognizing the system. We know that in New Jersey, there's been national news in the New York Times about the overuse of surgical births, which has long-term impact. And this was an article a year ago from the New York Times focusing on New Jersey, where we see the role of racism in maternity care, and we see the role of economics in maternity care. And by the way, all of these slides will be available. ACNJ will send them out. But we have to tell the truth. And so we can't put transforming maternity care on the back of doulas. We can recognize the individual care and the interpersonal support that doulas do as we hold the system to accountability. So doulas disrupt the system in the best way, because there is something about that interpersonal neurobiology of support, education, advocacy, and love. And doulas are becoming more and more popular. There's more and more payment mechanisms. And in the final few minutes, I'm just going to share that part of my role at Montclair State is to support national workshops and programs and payment mechanisms of doulas happening around the country. So I'm always very curious about other states, and I love what was released by the State of Doula Care in New York City. So this is the 5 boroughs right next door to us. And their priorities are to increase access to doulas in underserved communities, build doula capacity, make hospital environments more welcoming to doulas, amplify community voices to expand access to doula services, and improve data collection. If you want any more of this national landscape, definitely email me. Some of the work that I do in terms of building doula capacity, looking at programs and sustainability for doulas. I get a lot of questions about doula implementation. And doula implementation, there's toolkits, there's resources, there's research. But we always, of course, undo racism. We always, of course, bring doulas as policy partners. We make sure that everyone knows about the role of the doulas with mutuality and sustainability for employment. And I will say that part of what I do at Montclair State University is I'm a community doula mentor and co-facilitator for PMCH. That's one of the 3 maternal health consortias. They have, and I'm saying this because I'm contracted for this, but there's doula education all over the country. This is just one. You can definitely find ones that fit within your philosophy or your attunement. But these are some of the things that, as a doula educator, my colleagues and I co-facilitate on that are competency-based and really support the learning, growth, and development of doula education in the northern part of the state. There's so many reports. There's so many resources, from a tremendous report on, again, clarifying the role of doulas, to one of my favorite books called The Birth Partner. And I would be remiss if I didn't recognize the words of author Timothy Snyder on tyranny, who wrote in his book that amidst the overculture, the charge to practice corporeal politics. And what that means, he says, is power wants your body softening in your chair and your emotions dissipating on the screen. Get outside. So I charge you with finding some of my favorite flowers that are still available right now, blooming outside my office: asters and goldenrod. These are ecological keystone, good for our environment, good for our sustainability. And this time is requiring that we not only focus on healthy, sustained families, high value maternity care, but that we take care of each other and we take care of ourselves. So here's my contact information. I work at Montclair State University. My email is there. My LinkedIn is there. And I'm also part of the Institute for Medicaid Innovation. So I get to work with a lot of other states. And I'm so honored to continue this conversation, where ACNJ will be introducing a tremendous midwife who can celebrate birth centers in her own right. So thanks.
Thank you, Jill, so much for all of that very informative information. I am now going to hand it over to Trinisha. The floor is yours.
My name is Trinisha Williams. I am a certified midwife and I'm licensed in New Jersey. I'm also president of the American Association of Birth Centers. I have been a midwife for over 23 years, and I have a lot of information to share with you guys about a little bit about the snapshot about birth, and particularly with midwives in New Jersey. And midwives play a vital role for maternity care in New Jersey. There are about over 250 certified midwives and certified nurse midwives that practice in New Jersey. I was unable to find the data exactly on how many certified professional midwives are in the state, but I can tell you from experience, I would imagine it'd be somewhere around 50 to 75, because I've talked to and been able to advocate for a lot of them within the state. We noticed that about 8 to 10% of all births within New Jersey occur with midwives within the hospital system. And we know that midwives have a proven track record, that in terms of them working with families to understand what exactly each family needs to be successful with the type of birth that they want. And if not, then being able to give them the information and the evidence behind why whatever their desire is may not be the best thing for them for that particular birth. I want to talk a little bit about the different types of midwives. Let me see. I think, yeah, we got the different types of midwives here. Just because sometimes I want to level set and make sure everybody knows that there are 3 types of midwives that can practice within our state, but technically there are 4 types of midwives. The types of midwives are certified nurse midwives, certified midwives, certified professional midwives. And those midwives are all licensed within New Jersey, which is a great benefit to all the birthing people and families within New Jersey. But the challenge is how they're able to give the care that they need to those families that deserve that type of care. We also have one other type of midwife, which we don't talk so so much about, which is traditionally trained in direct entry. Those are more of an apprenticeship model, and we don't see as many of them within the state of New Jersey, but they do exist. I just wanted all the listeners to know that that's something that may be around. I just want to sort of focus in a little bit around what type of care that these types of midwives provide. Certified midwives and certified nurse midwives provide full scope reproductive care throughout the lifespan of menstruation all the way until menopause. They have prescriptive authority, and they usually operate within hospitals, birth centers, and homes. While our other colleagues, certified professional midwives, primarily deliver in birth centers and home, and there is limited legal representation of them within New Jersey. And I'm going to get into that in a second and how you may be the vehicle to help us make this difference. By the numbers, mention some of those numbers about New Jersey and the midwives. The biggest thing I want you guys to recognize is that we do have a racial disparity that's happening. We understand that Black women are 3 to 4 times more likely to die within the state from preventable causes, and how we can all impact on that. I think there are 3 freestanding birth centers in New Jersey. Somebody the other day told me there were 4. I don't know. Even though I'm the president of the American Association of Birth Centers, sometimes it's hard to keep up with all the facilities that may be opening. I do know we do also have an alongside unit a little further south into the state, which means that that is like a hospital that operates as a birth center and really sort of hones in on the type of maternal care that low-risk families need. All right. So the impact of midwives and maternal health. We all kind of know a little bit about this, that they lower cesarean section rates. We help with reducing preterm births. We lower the impact of low birth weight. And some of that is by the conversations we have with families, talking to them about nutrition, getting into them and understanding meditation, talking about alternative remedies, talking about exercise, all the things, breastfeeding. And that's what really makes a big difference. We also notice that midwives are able to bring better patient satisfaction, as well as culturally competent care. And that's because a lot of times midwives have done their work, they've done their reading, they understand the discrepancies that affect different birthing people and try their best to meet those needs, even if they're not from that same culture. And we all live with midwives within the evidence-based practice that we try to practice all information that is based upon research and education to be able to help all families. So there are some challenges that we have in New Jersey, and I'm hopeful that you guys will be able to help us. And I thank ACNJ for help giving me this platform to highlight some of these challenges. And some of them is limited licensure for our certified professional midwives, particularly with hospital privileges, as well as just licensure to be able to practice freely within the state. Some of the pressures on them are collaborative agreements and finding physicians who may be supportive of the type of care that we want to give birthing families. We also find the next challenge is that there's low reimbursement rates, whether that's through Medicaid or private insurances. We often find that birth center care as well as home birth care is not fully covered. And then we have a workforce shortage. We don't have enough midwives to meet the needs of all those birthing families. And sometimes the other challenge we find is systemic racism and bias, and whether that comes from the providers of all types or from the families that we say we want to represent, but may not totally understand what that family may need. With these challenges, with these things coming in, these always create challenges, and we always need more help with advocacy. And we're grateful for ACNJ for giving us this platform to be able to advocate for some of these things. Right now, as we sit, we have a maternal health bill on the docket to be able to access better more expansive ability to give care to all birthing families. And that would be having the midwives be able to be underneath the board of midwifery and not under the board of medical examiners. It also will look at expanding Medicaid and insurance reimbursement and support midwifery education pipelines. We also, as midwives, we have the challenge of trying to look at promoting diversity and anti-racism within midwifery, as well as expanding access to birth centers. Some of the futures of midwifery in New Jersey will look at physiologic birth and look at how we can center our birth care around the patient and not that of the provider or the other systems that are around us, to make sure that we are looking at expansion mechanisms to provide more birthing people access to midwifery-based care, and that we're able, midwives, to collaborate more with our doctors, our doulas, and other birth workers, whether that's lactation, whether that's physical therapy, occupational therapy, mental health, health, all the things, psychiatry, chiropractic, I can keep going on, but you get what I'm saying. The whole modalities that birthing people need throughout their pregnancy. And midwives need to be seen as essential leaders in the conversations of maternal health and disparity to make sure that we're at the table, making sure we can make the decisions that impact the care that our families so deserve. So I just want to sort of give you guys all a task since I've been given this platform. I want you to look at the QR code. We have a new task that we're looking at. We would love to envision a world where 50% of all the babies born in the United States would be in the hands of a midwife. And we are asking folks today to start to take the pledge to be able to ensure that we can get all of these babies born in the hands of the midwives. And we know that by having this pledge, it's just sort of the first step of all the systems that need to change to allow this to happen. The next thing that I want you to do with my QR code to take the pledge is right there, so you can pull out your phones and do that. The next thing I want you guys to do is support some midwifery legislation. We have two important bills that really need to get through this year. The first one looks at midwifery licensure, that midwives would be licensed under the Board of Midwifery, not under the Board of Medical Examiners. What we have found is that when they're under the Board of Medical Examiners, they may not understand the full scope that midwifery has and how we can better work together. It also then allows us to sort of be supervised by a physician, that in which we find there's limited number of physicians that want to do it, and the cost and the burden of that cost on the midwife, and therefore that burden of the cost then comes on to the patient. The second bill will look at the reimbursement. Remember, I mentioned earlier about Medicaid coverage for home birth and birth centers. We need to expand that. So if you can call your elected officials, whether it's your Senate or your assembly person, sorry, let me to be sexist, in our state, and ask them to sign on to these bills to be able to give people access to midwifery-based care. I've listed my references there in case you guys want to look at those. You can always follow up with ACNJ for a copy of those. And my email address in case anybody's looking for me. And that's it. Thank you so much for your time, and turn it back over to our moderator.
Thank you all so very much for all of that powerful and informative all that powerful information and the informative overview. Trinisha and Jill, we can't thank you enough also for all the kind words that you said.